Elon Musk is known for his unique ventures like Tesla, SpaceX, Neuralink, The Boring Company, and more. In a recent tweet made by Elon, he presumed that a cure for tinnitus might be just 5 years away, while responding to a question about Neuralink. Welcome to Science Today, where we present to you the latest news and research within science and technology. In today's video, we'll be looking at Elon Musk's Neuralink and how this breakthrough technology can cure different brain diseases. Our brain is a piece of flesh with an odd appearance that gives you an impression of something that has undergone severe wrinkling on its surface. This organ sitting inside the skull is responsible for a lot of voluntary and non-voluntary actions that we perform. With an average count of 86 billion neurons and 100 trillion connections between them, it makes you aware of what you see, hear, smell, touch, and taste. From basic motor functions to complex cognitive tasks, we rely on it round the clock. This complexity of the brain makes studying it an arduous task, but that's not going to stop us from poking our noses into it. If not noses, we would do it at least with our technology. For those who don't know, tinnitus is an auditory disorder that causes ringing in your ears. The noise may be continuous or intermittent, though it can't be considered a hearing loss or not likely to cause one. This ringing can disrupt even our day-to-day tasks by interfering with the concentration and focus we need to do them. It may be caused by infection, blockages in the ears, or as a side effect of medications, in which case it is more likely to disappear once it is treated. But another cause of tinnitus is the damaged cells or nerves associated with hearing, especially the vestibulocochlear nerve. The vestibulocochlear nerve is responsible for signaling the brain about what you hear and the orientation of your body in space to maintain balance. Damage to this nerve can result in not just hearing problems, but also dizziness and balance issues. Injuries to the head or neck, exposure to loud noises, even for a brief moment, and Meniere's disease are a few factors that could cause damage to the vestibulocochlear nerve. Tinnitus caused by these is hard to treat, and there are only a very few options available for them. Some people use sound maskers to create a white noise in the background, which would help them cloak the ringing. Next to that, a remedy is to train the individual to ignore the noise through therapy. People with tinnitus will find it more annoying in a quiet environment since the ringing will be more apparent. Imagine having a condition that lets you hear things that others can't. That would make a decent plot for a horror movie. It's not too much of a rare condition. Tinnitus is experienced by around 15 to 20% of the population and is common among older people, as their cochlear cells will have deteriorated as a part of aging. With no better treatment in hand, tinnitus is really a worse condition that could push you to the verge of craziness. This is where Neuralink comes in. Neuralink is a neurotechnology company that is attempting to make a breakthrough in the field with its brain implants. But why do we need one in the first place? According to Elon Musk, humans must biologically merge with technology in order to avoid being left behind due to the rapid advances in artificial intelligence. Also, to study the brain in more detail, we've been using electroencephalography, otherwise known as EEG, which can pick up the electric signals moving around the brain by sticking it to the scalp. Unfortunately, with this method, what we get is a summation of all the neural signals in the brain rather than the individual ones. This limits us from knowing about the neurons associated with different tasks in detail. By making an implant directly into the brain, we can study the voltage generated by each and every neuron, filtering out all the noise we would hear when using EEG. Deep brain stimulation is the method of implanting electrodes to help people with movement disorders such as Parkinson's disease, tremors, and paralysis. Psychiatric conditions like obsessive-compulsive disorder are also being treated by this. At present, the implants we use consist of a pacemaker-like device that will be placed inside your upper chest to act as a power supply. From there, it will be connected to the electrodes planted in your brain by running tiny wires under your skin from shoulder to head. Elon Musk's Neuralink plans to improve this with their BCI device known as Link. Link is a button-sized disc that contains components that are responsible for collecting, processing, and transmitting signals received from the brain. Extending from it are 64 flexible threads, each of which contains 16 electrodes. These threads will be responsible for carrying the electric impulses gathered from the neurons they are connected to. Unlike the present-day brain implant surgeries that are done by surgeons, These Neuralink devices will be planted with the help of a robot. The neural threads in this device are 1/4 the diameter of our hair. This makes it impossible for a human to physically handle it. Rather, a robot will operate the procedure by drilling a fingernail-sized hole in the skull, guided by a neurosurgeon. It will also make a detailed map of threads that can later be used for troubleshooting issues. And the interesting part is, you don't need a battery inside your chest. Instead, you'll have a rechargeable battery within the Link device that can be charged wirelessly. By placing Link in between the brain and the ear, we may be able to regulate the flow of electric signals the way healthy ears would do. In simpler terms, this Neuralink device will be an artificial nerve in between the two essential organs. In April 2021, they demonstrated the device to the general public with the help of Pager. Pager is a monkey with Neuralink implants placed inside his skull. Even at the size of a monkey, the scar from the surgery was hardly visible. Initially, Pager was presented with a game of matching a box with a ball and also given a joystick with which he did a good job matching them. Later, the joystick was disconnected, despite which he was matching the ball perfectly. Behind the scenes, a computer program was using the feed from his Neuralink device to move the ball as he wished, just by thinking about it. Poor Pager didn't know that his joystick had been made a dummy. This demonstration wasn't something new to the field of neuroscience. Neural implants have been in use in the field of medicine since the 1960s. Previously, in 2002, a group of researchers had trained a monkey to move a computer cursor with the help of neural implants. Many of the neuroscientists who were expecting to see a major breakthrough by Elon, the way he did with reusable rockets and electric cars, were met with disappointment as there was nothing revolutionary demonstrated by him except for the electrode count. The package of 1,024 electrodes given by Neuralink is certainly an accomplishment. It is more than 10 times the number of electrodes available in the Utah Array, a brain-computer interface device designed by BlackRock Neurotech, one of their competitors. The claim made by Elon Musk may be an exaggeration, as their technology has not yet been tested on human test subjects. Given that the brain is a spongy organ that moves a lot inside the skull, implants placed inside it could risk damaging the neurons or blood vessels during the movement. Also, the neural activity carried out by the brain is a result of chemical exchanges taking place inside it. These chemicals are corrosive in nature, which would be bad for electrodes as they could release toxins into the brain when they corrode. Though Neuralink has made its threads flexible and coated with polymers to not take or cause any damage once placed inside the skull, it still has to receive FDA approval before it can be used commercially. Undoubtedly, it would be a major milestone in the field of neuroscience if Musk could get Neuralink to cure tinnitus by 2027. But considering the rate at which things progress at Neuralink, that day may be a bit far away. Meanwhile, their competitors, namely Synchron, Precision Neuroscience, BlackRock Neurotech, and BrainCo, are already in the process of seeking FDA approval. Among them, Synchron has gone a step further by receiving FDA approval to start its clinical trial. So it doesn't necessarily have to be Neuralink that paves the way further, but we can be positive about watching this happen in our lifetime. Thank you for watching. Give us a like, subscribe, and let us know your thoughts in the comments. We'll get back to you with the next big news in science and technology.